Welcome to the Living Guideline for Pediatric Concussion Care. Access the Living Guideline by visiting PedsConcussion.com or following the Living Guideline team on Twitter @PedsConcussion. Listen to an impact story from one of our concussion experts. Meet Dr. Christina Master, a sports medicine pediatrician with expertise in primary care sports medicine and brain injury medicine.
Hello, I'm Dr. Tina Master. I'm a pediatric sports medicine specialist at the Children's Hospital of Philadelphia. I'm the co-director of the Minds Matter Concussion program here, and my primary interest in both clinical care and research is the care of children with concussion.
How can the Living Guideline for Pediatric Concussion Care help healthcare providers with their concussion practices?
The reason why these living guidelines hopefully will be very useful is because we're trying to make sure that that is the most up-to-date resource for you in terms of the latest evidence base, in terms of diagnosis and management, and a place that you can turn to for reliable, up-to-date information. Taking care of concussions can also really require the involvement of a pretty diverse multidisciplinary team. Besides physicians and nurses, you may be involved with working with physical therapists or occupational therapists or athletic training staff. From that perspective, you may be interacting with schools and school nurses and teachers as well. And so, as you can imagine, a concussion can touch many areas of life. And as a result, you may need an entire team to be able to take care adequately and optimally for your patients with concussion. This is where the Living Guideline can be really helpful in that it does take a multidisciplinary approach and recognizes that it's not just that you go and see a physician for your concussion, but you may see many folks who are involved in your care. So whether it is the school nurse or a psychologist or neuropsychologist or a physician, the Living Guidelines have addressed the issues that may be arising in the care of your concussion and maybe questions that your patients and families have. In this way, hopefully the Living Guidelines can support you in that interdisciplinary work with the multiple diverse members of your team. And as they always say, it takes a village to get some of these things done.
How can the Living Guideline for Pediatric Concussion Care help healthcare providers with their concussion practices?
We hope that the Living Guidelines can be a really useful, practical tool for you in your practice. What we hope that it will be able to provide you is real-time access to the most up-to-date information about diagnosis and management of concussion. The couple things that we would encourage you to look for as you're going through the guidelines is to see that you don't have to reinvent the wheel when you're addressing the issue of concussion with your patients. You can go to the Living Guidelines and get standardized, high-quality direction in terms of how to approach the diagnosis and management of concussion. The beauty of the standardization is that you know that these are high-level, high-quality recommendations that are made. But beyond that, in addition to being standardized, there are opportunities that you can use to tailor the guidelines to your specific patient's needs. And from that standpoint, what's lovely is that then you don't have to spend your time reinventing the wheel. You can have a really strong evidence base to start from and then tailor it to your patient's needs. The other aspect with which I would really encourage you to search through the Living Guidelines is to find out the most up-to-date recommendations in terms of active management of concussion. Gone are the days where we're just going to sit back and passively wait and see and hope you get better and cross our fingers. We know now from the evidence that there are actually active ways that we can support and manage our patients with concussion so that they can get better in the most optimal and quickest way possible. So I would definitely encourage you to seek those out as well so that you can be doing the most active and the most proactive and up-to-date management of your patients with concussion.
Thank you for watching and listening to this impact story. Remember, you can access the Living Guideline by visiting PedsConcussion.com or following the Living Guideline team on Twitter @PedsConcussion. Here is some information about Christina Master. Dr. Master is a pediatric and adolescent primary care sports medicine specialist and an academic general pediatrician at the Children's Hospital of Philadelphia. She works with the Division of Orthopedics, the Sports Medicine and Performance Center, and the Division of General Pediatrics Primary Care. Her other affiliations include Professor of Clinical Pediatrics at the Perelman School of Medicine at the University of Pennsylvania in Philadelphia. Dr. Master is a member of the expert panel for the Living Guideline for Pediatric Concussion Care. This video touched on the topic of best practices in concussion care. The views expressed in this video represent those of the interviewee. Those interviewed have provided their consent to be filmed for educational purposes and have approved the content within this video. This work was funded by the Ontario Ministry of Health, grant number 720. The template and icons used in this video were provided by Canva at canva.com. The image of Dr. Christina Master was provided by the Children's Hospital of Philadelphia at chop.edu. The media content in this video is for non-commercial use and is licensed by iMovie Apple software. The royalty-free audio soundtrack in this video is entitled Waves by Founder. Thanks so much for watching and listening to our video. Please access the Living Guideline by visiting PedsConcussion.com or by following the Living Guideline team on Twitter at PedsConcussion.